Here at Motion Rehab, we often see individuals with functional movement disorder, and that's when we see individuals who have a physical manifestation of psychological stresses or illnesses, and that means they can present with weakness, paralysis, difficulties with their balance and moving. What we do find is that they have a great outcome because the high repetition practice with the feedback from the devices telling them that they're doing things right in a safe and constructive way with lots of positive reinforcements means that they get tremendous outcomes, and we see a lot of return to function after participating in our programs.
We've had really good success with patients both with upper limb and lower limb problems with functional movement disorders. We've had one lady who really struggled with a hand function, so she really struggled to kind of work on separation of her fingers, looking at hand and functional movements. So we worked heavily on the Amadeo, looking at her hand and wrist. We also looked at Pablo for her, so again looking at cutlery, looking at shoulder movements and body trunk movements. A lot of them need a little bit of support with kind of management of their symptoms and also the emotional impact that functional movement disorders can bring, so a really collaborative approach with the full MDT.
What's unique about Motion Rehab is that our robotics and VR suite is here permanently for patients to use. Patients need to do high repetitions and lots of practice in a dynamic environment. And we know this from research not just in the neurological rehab field, but in child development, education and sport. The more you do, the better you get. When you arrive at Motion Rehab, you'll have an appointment with one of their highly skilled team. They'll do an assessment with you, see what you can do, what you find a little bit more difficult, and crucially, what is important to you and what you want to achieve from our rehab programme.